When you say single payer, could you maybe explain that a little bit so that it doesn't sound as confusing as it is?
We probably need a better word for it, Eden, don't we? It's essentially, one way to look at it is we have a Medicare system in place now for all of our seniors. What I support would be essentially Medicare for all. Let's apply a basic level of benefits to every American, whether they're young, old, in work, out of work. Now, beyond that, people will be able to purchase supplemental insurance or gap insurance, but at the very least, nobody will have to worry about losing their house, declaring medical costs the number one cause of bankruptcy. Nobody will have to worry about that if we have a Medicare for all based approach to healthcare in this country.
And sometimes there's confusion about what that might mean in terms of single payer. And if I'm not mistaken, it really actually just means the doctor and the patient directly. Is that accurate?
Yeah, and I've talked to some healthcare providers in the area. For instance, I actually toured and met with folks at Kaiser just last week, and they would be able to operate under this model. The folks that have to worry, that lose business from this model, are the insurance companies, because essentially it's taking some of that insurance role and saying, you know what, we can do it by having us all in one risk pool together, just like we do with seniors today. So when people ask me, hey, is it similar to Canada, what Canada does, or what England does, or what Germany does? My answer is no, it's actually similar to what we already do in this country with our seniors. And you know what? I know there's frustration out there about Medicare. Some people, it's difficult, the prescription drug program, but you know what? It's a lot better that we have a Medicare than if we don't have Medicare. Where would we be with millions of uninsured seniors if we didn't have Medicare? Well, you know what? We're in that same place today with millions of uninsured younger people that lack health care insurance.
And the insurance companies still play a role in Medicare and Medicaid in most states, do they not?
Yeah, absolutely. People can purchase supplemental insurance, gap programs. Medicare recipients today can assign it to Kaiser if they want to, and they can use that as their care provider. So I think more patients would have more choices under this kind of health care reform.
On your website and in your campaign speeches, you talk about not accepting PAC money. Could you explain what that is?
Yeah, it's an extremely important distinction as well, as voters are also making up their mind between the candidates in this race. It was one of the reasons that I supported Barack Obama. He never took a penny of PAC money, and he also, the DNC, the Democratic National Committee, recently announced that they're not taking lobbyists and PAC money. What PAC money is, it stands for Political Action Committees. So these are not living, breathing human beings. They're instead effectively the influence buying arms of the special interests. It could be corporations, could be oil and gas industry associations. Now, we have good ones too on our side. I mean, we have equality PACs, we have environmental PACs, but my argument is that there's always going to be more money on the other side of that coin.
Right.
The progressive side is never going to be able to win that game. So why do we continue to fight this game? What's preventing universal health care? It's the huge political action PAC committee apparatus of the pharmaceutical and insurance industry. What's preventing stronger environmental protections? It's the PACs in the on the oil and gas industry. And you know what? I bet we're able to do some great things with equality PACs, but I bet there's just as much money, if not more, on the other side of that one too, with all the focus on the family groups and all of those far right groups that also have PACs. So I'd like to see our campaign finance system have a public financing aspect to it, where the federal government can match small donations. We ban PACs, and we have free airtime for candidates who make the ballot and are actively campaigning for office.
Thank you for explaining that as well. And that leads me very nicely to, there's been some criticism about your campaign in that it's being labeled as the self-funded campaign that's trying to buy a seat, and more recently connected to the fact that you've been able to air commercials to reach out to voters so that they know who you are and what you're talking about. I wonder if you can tell us about your funding plan and what your reaction to that accusation is.
You know, the very thought that somebody could buy a seat is an insult to the intelligence of voters. Nobody's vote can be bought. I mean, that's it's a great insult. So I mean, first of all, I'd say, first of all, I'm proud. I've actually raised more money from individuals than any of the other two candidates. So I have this very broad base of support here in the district and nationally. And of course, I'm thrilled to be able to invest my own resources alongside that. Of course, we're up on the airwaves. The election starts in about 27 days when mail ballots go out, and you're going to be, hearing and seeing about a lot of ads for my opponents as well, because all three candidates in this election have raised over $1 million to get the vote out to people and get the message out to people. And you know what? We have to get the message out. In addition to the work I do door-to-door, meeting people, which I do every day, you have to be on television and you have to play that game as well just to get your name out there. But you know, what I think most voters are concerned about are the issues. So I mean, they're concerned about whether it's choice, whether it's marriage equality, whether it's the environment, whether it's getting our economy going. They want to elect the person who's going to do the most on those issues. So it's my challenge to convey to voters, you know what, I'm the only person who's created hundreds of jobs in the private sector. I've run public schools. I've been on school board. And I have the energy and the ideas, and I'm not beholden to anyone. And I will be the champion of your issues if you send me to the United States Congress on August 12th. And I think we've been very effective so far in getting that message out.